There are two different kinds of chelation. The specific chemical compound utilized intravenously by us in the clinic are calcium EDTA and sodium EDTA. Calcium EDTA is more utilized to detox a person or remove heavy metals that are detected by a heavy metals test, which is actually a chelation treatment in and of itself. But calcium EDTA, the molecule, already contains calcium. So calcium EDTA does not pull calcium out of the body, but it will chemically bind with heavy metals like mercury, lead, aluminum, cadmium. There's about a dozen of them, to pull them out of the body. And a typical protocol is 1 to 2 treatments per week intravenously for a total of 15 treatments, and then we retest to check on what the current levels are of these heavy metals. The other molecule I mentioned is sodium EDTA, and this specific molecule is utilized to improve the circulation, specifically of the heart and the brain. And the way it does this is sodium EDTA does pull calcium out. And the important factor here is that calcium is part of the skeletal structure of plaque material, which are the deposits that build up inside or can build up inside the arteries of the brain and the heart and any organ, but those are most important. And the sodium EDTA must be administered slowly, and it goes in and pulls this calcium out of the plaque material, which causes it to crumble and dissolve into the blood and can then be carried out through the kidneys to remove it from the body and ultimately improve the circulation to these two specific organs. And again, the protocol is 15 treatments, 1 to 2 times per week, in order to improve these organs' circulation. There are 2 recent studies, one in 2006 and one being carried out currently, that have shown a marked decrease in a recurrence of heart attack or stroke in people who had previously had an attack of that kind and underwent chelation therapy, and then statistically dramatically improved their physical health by having a series of chelation treatments, most notably with sodium EDTA, so that it has proven beyond the shadow of a doubt to be beneficial to treat these conditions, such that there are current forward-thinking cardiologists that are saying chelation should be a part of standard cardiology today to prevent heart attacks and specifically to prevent recurrence of heart attacks and strokes. We do use chelation in our cancer treatment protocol here at Reno Integrative Medical Center because many of the chemo drugs that we use in IPT at only 10% of the dose, the full dose, they still, at that 10%, contain certain types of heavy metals, as they're called. And we provide a chelation treatment at the end of each week of treatment for cancer in order to remove these heavy metals back out of the body after they've done their work of killing cancer cells.